South Africa's infant mortality rate is at its lowest in almost 2 decades. It has fallen by 32%. That's between the years 2002 and 2017. The improvement is attributed to a sharp increase in the rate of antenatal first visits by pregnant women. These findings are featured in the 2018 South Africa survey published by the Institute of Race Relations. In studio now, I'm joined by an IRR analyst, Tawanda Makombo, who's going to tell us a little bit more about this. Tawanda, thanks so much. Thanks very much for coming in.
Thank you for inviting me.
So this is good news. We really are sort of happy to hear this because it's almost contrary to what we hear going on in the health sector here in South Africa. So talk to us about this news.
Yes, according to research, the infant mortality rate has been decreasing for almost 2 decades now, and the rate has decreased by about 32%. And much credit is given to the increase in the number of women who are having antenatal visits. The rate has increased by almost 96% since the year 2006.
Yeah. I mean, these are great numbers. So it's gone increased by 96%. That's the antenatal first visits, yes, from 31%. And I think that this is great. But give me the reasons behind all of this. Why is it suddenly getting easier and better for these visits and for antenatal care?
Okay, we think right now with the education that has been given to women by the Department of Health, I think they are understanding that it's vital, it's of paramount importance to actually visit healthcare practitioners when they are pregnant for scanning and all that so that they can check if the baby is okay.
Yeah. In terms of this infant mortality rate decreasing, what age group are we actually talking about?
Okay, we're talking about the infants who are 1 year and below. So
it's 1 year and below.
Yes.
I was assuming maybe 2 years, yes, and below, but this is 1 year,
yeah,
and
1
below.
year and below.
Okay. And the study, how was it conducted? I mean, did you take into account the differing populations here in South Africa, urban and rural?
Yes, all of them, they were included, and we obtained our statistics from the Department of Health and Stats SA.
Yeah. All race income groups included?
Yes, all race and income groups included.
So I mean, this is a very, very positive story that we can gather from. But some of the recommendations that came out of the study, though, it's saying that the Department of Health must intensify public awareness efforts and also still work with pregnant women and persuade them and encourage them to go for antenatal visits. Is that something that you're still finding needs to be done?
Yes, even though the rate is at 96%, I agree that's a good story to tell. But we feel like more can still be done. Why can't we have 100%? And almost each and every woman must know that it's important to go and see a health practitioner when you're pregnant. There's no any other way.
Yeah. I mean, are there studies into that, of women that are pregnant and visiting health practitioners and access to health practitioners? Because those living out in far rural areas, you know, for a pregnant woman who's 7, 8 months, I mean, and now I'm exaggerating because it even gets a little bit more difficult, to walk for kilometers on end to try and get to a healthcare practitioner, that's very, very difficult.
Yes, but right now, if you can see, we have got mobile clinics and everything, so they can actually go to where the people are staying. So it will be easier for someone who is pregnant to travel and see a health practitioner.
Yeah, so access is something that is improving and it is helping people much more readily than it was in previous years.
That's very true.
That's fantastic. Well, this is such good news, and I'm happy that you came in to share it with us. This is talking to us from the Institute of Race Relations, Tawanda Makombo, basically saying that their findings are showing that the infant mortality rate is at its lowest in almost 2 decades. So some good positive news, but we're hoping that we can get those figures up to 100% now, and that parents do take their kids and make sure that they take them for their checkups and their vaccines. That's something I never asked you about. Vaccines, vaccinations, are we up to date there? I mean, does the study include that for babies and vaccines and the access to that?
Yes, when it comes to vaccinations, the numbers of babies, the number of babies that have been vaccinated has been increasing over the years. And we can even see with the numbers of children who are under the age of 5 who are being admitted to hospitals because of malnutrition. Since 2003 up to date, there's only less than 50,000 kids. So we think it's really working.
Good. Thank you. Thanks again for coming in to talk to us about this. Let's take a break here on the program. When we return, we'll bring you some sports news. Stay tuned.